Hello everyone. This short lecture aims to provide an overview of the national requirements for the accreditation of RECs in the Philippines as mandated by the Philippine Health Research Ethics Board or PHREB. The REC accreditation system in the country was established by PHREB in December of 2015 in fulfillment of PHREB's function to develop guidelines for the establishment and management of RECs and standardization of research ethics review, as well as monitor and evaluate the performance of these RECs all over the country. For this presentation, I will refer largely to the July 30, 2020 accreditation policies and requirements of the Philippine Health Research Ethics Board, supported by provisions in the National Ethical Guidelines and, of course, the PNHRS law, which we have previously discussed. I included the WHO standards and operational guidance as the reference document for the management of conflict of interest in the structure and composition of the Ethics Committee. I would like to begin by defining the REC. REC stands for Research Ethics Committee, and it is defined in Philippine policy as a body that makes independent decisions regarding the review, approval, and implementation of research proposals in order to ensure the protection of the rights, safety, and well-being of human participants and the integrity of research data. It is important to emphasize that in the Philippines, based on this policy, RECs can only be institutional in nature. That is, it should be based in an institution, unlike in other countries like the US, where there are independent ethics committees that provide a review service to institutions through a contract. And in the Philippines, PHREB is the competent authority that oversees the functions of ethics committees. PHREB has issued general policies applicable to all parties involved in research. The first and most important one is enshrined in the PNHRS law, which states that all health and health-related research involving human participants shall be reviewed by a research ethics committee. These general policies specify that research proposals involving indigenous cultural communities and indigenous peoples are required to be reviewed by an REC with a Level 2 or Level 3 accreditation, in addition to approval obtained from the National Commission for Indigenous Peoples or NCIP. PHREB also clarified that the review of animal studies is not part of the responsibilities of the REC, since this is the role of the Institutional Animal Care and Use Committee, or IACUC. But in case the institution has only one committee, the REC can do the review provided the appropriate expertise exists in the said committee and that such research projects are separately archived or filed from those that involve human research. The same is true with research projects with biosafety issues, which ordinarily require a biosafety committee. The function may be performed by a single committee, which could be the REC, provided the appropriate expertise exists. Accreditation by PHREB is mandatory, therefore all RECs operating in the country are advised to seek PHREB accreditation. And in case the accreditation of the REC expires, PHREB gives notice in their policy statement that the accreditation status is published in their website for the information of interested agencies networking with the PNHRS, including funding agencies. Level 3 RECs with expired accreditation are prohibited from reviewing new applications of clinical trials intended for FDA registration. We emphasized earlier that RECs in the Philippines are required to be institutional in nature for various reasons, including that of sustainability. And PHREB recognizes the following institutional types: academic, hospital, government, cluster or group of institutions setting up one REC, or a research entity that is not subsumed under any of the types previously mentioned. Accreditation presupposes compliance with international and local guidelines and regulations, as indicated in our REC definition earlier. Based on PHREB policies, accreditation mandates the observance of 6 standards. The first standard pertains to the structure and composition of the REC, which means integrating important attributes such as independence, multidisciplinarity, gender representation, age representation, ethics training, expertise related to protocols commonly reviewed, and management of conflict of interest. The authority of the REC emanates from a policy issued by the institution requiring REC review for human research. Then a sufficient number of members should be appointed formally, supported by terms of reference related to their functions and responsibilities, including attendance in meetings and commitment to attend training. Training required includes basic research ethics, standard operating procedures, and annual update training. Additionally, Level 3 RECs must undergo training in Good Clinical Practice or GCP. Membership must comply with the WHO guidance for ethics committees that discourages the appointment of institutional senior administrators in order to address potential conflict of interest. The REC must appoint a sufficient number of members so that quorum for full board meetings will be met. Most RECs appoint at least 9 members so that the minimum quorum of 5 will represent the majority as defined in the provisions of the national guidelines. The second standard refers to standard operating procedures, the minimum set of which may be found in the PHREB workbook, standard forms, and consistency of implementation in terms of turnaround time, decision points, and processes. The third standard is completeness of the initial review process, including assignment of appropriate reviewers, consistent and meaningful accomplishment of assessment forms, and comprehensive discussion of scientific and ethical issues during REC meetings. The fourth standard is adequacy of post-approval procedures, which accounts for the requirement for submission of reports from approved projects and inclusion of reports in the meeting agenda and corresponding assessment of such reports. The fifth standard is the efficiency of the recording and archiving system, which means an appropriate protocol coding system, the use of physical or electronic logbooks that have real-time and tamper-proof records of submissions, completeness of protocol folders, availability of updated protocol databases, and systematic filing of administrative and protocol-related documents. The sixth and last standard is the adequacy of administrative support, which takes the form of availability of a designated support staff, provision of an office and equipment, and an approved annual budget for REC operations. PHREB issued additional instructions for universities in establishing RECs. For universities that have multiple parallel review panels, PHREB requires one unified set of SOPs to follow, which should include terms of reference that affirm the capability of each individual panel to issue its decision independently. And if the REC is established only for a unit within the university, the approval and endorsement of the university must be included in the accreditation application. To support the structure of the REC, the requirement for non-affiliated members may be fulfilled by personnel who have left the university but only after a year of disengagement to manage conflict of interest. All members must comply with PHREB requirements, so documentation for all these members must be submitted to PHREB. There are three levels of accreditation. Level 1 is a provisional accreditation given to new REC applicants. Provisional accreditation allows new RECs to acquire review experience and an opportunity to comply with PHREB recommendations. Level 1 RECs can review all types of research within the provisional accreditation period granted, except clinical trials for FDA registration. PHREB assessment will be conducted based on review of documents only, since there is no need to visit the REC, after which the REC is given 6 months to comply with PHREB recommendations. Failure to comply will terminate the accreditation process automatically. Level 1 accreditation may be granted for a whole year, and within the year, PHREB may recommend either submission of application for Level 2 or extension of Level 1 provisional accreditation and require further training and submission of additional evidence of compliance. Granting Level 2 accreditation can be approached in two ways. The first one is through satisfactory Level 1 performance for 6 months, or a direct application may be accepted from a non-accredited REC, provided this REC has more than 6 months of documented operation. PHREB assessment will be conducted based on documents review, just like in Level 1. Likewise, a Level 2 REC can review all types of research except clinical trials for FDA registration. Level 2 accreditation may be granted for 1 or 3 years depending on the degree of satisfactory compliance with PHREB recommendations. A Level 3 REC, on the other hand, is GCP compliant and thus can review all types of research, including those regulated by FDA for the marketing authorization of food, drugs, and devices. Unlike Level 1 and 2, a Level 3 accreditation needs a site visit for direct observation of review operations. And as with Level 2, accreditation may be granted for 1 or 3 years, but this time, There is a need for satisfactory compliance with ICH GCP standards in addition to PHREB standards and recommendations. Obligations of accredited RECs start right after accreditation has been granted. And the first obligation is to post the accreditation certificate prominently in the REC office to signify its accountability to the public, much like license holders display their license to operate for everyone to see. And every year, an annual report needs to be submitted to PHREB. This report is due on March 31 every year and captures relevant review information from the past year using the PHREB prescribed form. Lastly, a report is required if the REC encounters controversial ethical issues in the course of its review to facilitate collection of information that may need the immediate attention of PHREB. For example, knowledge of a vaccine trial that has no ethical approval, or maybe collection of specimen from IP areas without the mandatory approval from an ethics committee or from the NCIP. REC accreditation is for a maximum of 3 years for new RECs. Application for renewal must be submitted 6 months before expiration to facilitate the processing and review of documents submitted and to schedule a visit as in the case of a Level 3 REC. If you're interested to check the accreditation status of all accredited research ethics committees are published in the PHREB website, complete with the level of accreditation and corresponding expiration date. PHREB reserves the right to withdraw the accreditation of an REC if warranted by the REC's performance of its duties. One such instance is non-compliance with PHREB requirements, including submission of reports to PHREB. An REC that fails to submit an annual report for 2 consecutive years shall have its accreditation suspended and its name delisted or removed from the PHREB list of accredited RECs. Another is unjustified issuance of ethical approval or clearance, for example, approval of research that violates national laws and guidelines, lack of due diligence, and others that may or may not have resulted in harm to participants. Lastly, let me end with a short description of accreditation fees that may be incurred for planning purposes. There are 3 major considerations that affect fees. The first is travel, which mostly affects Level 3 applicants owing to the required site visit. The institutional applicant pays for transportation, accommodation, and meals of the designated accreditation team for the duration of the site visit. However, due to the pandemic restrictions, all accreditation visits since August 2020 have been conducted virtually. Hence, no travel expenses have been documented, and so far, REC expenses primarily covered the honorarium of the accreditation team. In 2020, PHREB standardized accreditor honoraria based on the DOST person-hour recommendations. These are paid directly to the accreditors themselves. Then we have the miscellaneous expenses like travel insurance, which can vary, and administration fees of 3,000 pesos for levels 1 and 2 and 5,000 pesos for level 3 paid directly to PHREB. This ends my presentation, so thank you all for listening. I hope that I was able to give a useful overview of the Research Ethics Committee accreditation process. If you have questions, we can address them now. Although, even if you have questions later, I would be more than happy to respond. You can send me an email through the address listed on this slide, and I will get back to you as soon as possible. Maraming salamat po.